hand hygiene. Hi, Mr. Jones. My name's Jeff. I'll be your student nurse today. I'm going to be changing your dressing on your catheter. So before we get started, can you tell me your full name and date of birth, please? And I'll check that against your wristband. Okay, that looks good. And do you have any allergies? No? None to chlorhexidine or tape even? No? Alright, that's good. Have you had your dressing changed before? Yeah? Alright. So do you have any questions about the procedure or what to expect? No? Alright, sounds good. So before we start, I'm going to set up my work area. So first I'll do hand hygiene. And I'm going to put clean gloves on and wipe down, disinfect the surface of my work area. Alright, so I'll take my wipe and just sanitize the whole surface nice and well, kill all the bugs. Okay, trash that. Now I'll let it dry for 2 minutes, air dry. Alright, trash those, do hand hygiene. Okay, and then I will take up all my supplies up onto, pretend it's been 2 minutes, it's dry. So take up all my supplies. I have my CVAD dressing change tray. I have clean gloves. I have extra pair of sterile gloves in case I contaminate the ones in the tray. And I have my bio patch. So first I will peel off the lid of my dressing change tray and tuck it underneath. And I can take out the sterile gloves, and I'll take out this mask because we don't need them since we're both wearing our masks already. And then I will open my bio patch and drop that in the tray. Alright, and then I'm going to take the old dressing off first. So I will do hand hygiene. And while I'm taking your dressing off and putting the new one on, I'll ask you to turn your head to your left so that you're facing away from the exposed wound site. So just putting on clean gloves for taking off the old dressing. So I'll start by taking the tape off of the tubing. Dropping that. So then I'll peel the tegaderm off. Working my way around the edges first. And then once I get close to the center, I'll secure the tubing down with my finger so that it doesn't get pulled out at all or pushed in deeper than we want it. Got the tegaderm off. Then I will take the old bio patch off. Okay. And then so the site's visible now, so I can assess it for, I don't see any bleeding, signs of infection, swelling, or redness, so that's a good sign. How was that? Was taking it off all right? Was it painful at all? No? Okay, good. Alright, so I'll prepare to put the new, or first I'm gonna clean your site with sterile gloves, so hand sanitize. And I will take my sterile gloves. Okay. I'll be careful not to contaminate them. So I've got these on, so I'll keep them in close to my body and won't let them drop below my waist. Drop down the trash. So I'm going to get the chlorhexidine sponge and I'll crack it to activate the chlorhexidine. Then with my non-dominant hand, I'm going to lift up the tubing so I can clean the skin in a 2-inch radius around the wound. Alright, and then I'm also going to clean up the tubing. Alright, so I'm going to let that dry for 30 to 60 seconds, air dry. Trash my sponge. We'll say it's been 30 seconds and it's dry. So I'll take my new bio patch, pinch it so the split opens, and then place it with the split facing up. Alright, so I can put that down, and then I'm going to get my new Tegaderm. And I'm going to place this over the tubing and the bio patch. Do my best to not get any air bubbles or creases. Try to make it nice and flat. Okay, and then I'll take the outer paper edges off as I go around, just following along and pushing out any bubbles or creases. Alright, and then I will write my name, my initials, the date and time on the label. It's the 17th, and it's 9:45. I should change it to military. Okay, and so I'll peel the label off. That. And then place the label on the top of the Tegaderm, on the actual Tegaderm, not the skin. Okay, it's nice, and then I'll get some tape to secure the tubing down. I'll make sure that the clamp is closed, which it is, and the cap is on the end of the catheter, so that's good. Alright, so you can turn your head back now, Mr. Jones. Thank you for cooperating. How did that procedure go for you? Was everything alright? Alright, cool. I'll do hand hygiene again. Do you have any questions for me about anything? No? Alright, so I'm just going to clean up my work area, and then I'm going to document the date, time, my assessment of the catheter site, and the patient's tolerance to the procedure. And that's it.